Dr. William V. Williams, MD, is a rheumatology specialist in Philadelphia, Pennsylvania, with over 40 years of experience in the medical field and has worked for over 30 years in drug discovery and development. He is a graduate of Tufts University School of Medicine and practiced at the University of Pennsylvania. Dr. Williams is currently president and CEO of BriaCell Therapeutics Corporation.
This is Dr. Bill Williams again, talking again about hormonally active contraceptives, the pill, the implants, the injectables, the cervical rings, all these different hormonally active agents, and the different effects that they can have on women. And one of those effects is autoimmune disease. Now, an autoimmune disease is a disease where the body mistakenly attacks itself. The immune system basically tries to reject different parts of your body, or it could be a general inflammation, as happens in some cases. Now, my clinical training is rheumatology. We deal with autoimmune diseases, so I know a little bit about this, and I know that they can be devastating to the lives of women who suffer disproportionately from all autoimmune diseases. Women in general are predisposed to developing autoimmunity more so than men. Except for specific instances of certain diseases. But in general, women are more susceptible, especially for the most prevalent autoimmune diseases. Now, some of these, unfortunately, the susceptibility is even worse or heightened when a woman takes a hormonally active contraceptive. So things like Crohn's disease. Crohn's disease is an inflammatory disease of the large and small bowel. And these women develop inflammation in those areas, can be very debilitating. A lot of the symptoms can lead to systemic symptoms. Weight loss predisposes someone to developing cancer later on. And turns out that the risk of developing Crohn's disease for ever users of hormonal contraceptives goes up probably about 40% based on the best epidemiological study that we were able to review. And if you're currently using hormonally active agents, it goes up 2.8-fold. That's a 180% increase. So this is clearly a significant problem. And another type of analysis has been done called a meta-analysis, which looks across multiple studies, and their estimate is 46 to 58% increase for current use of hormonally active contraceptives. Now, another one related to Crohn's disease is ulcerative colitis. Ulcerative colitis is inflammation limited to the colon, clearly predisposes to colon cancer later on. And here the evidence isn't quite as clear-cut, but when people have looked across multiple studies and done what's called a meta-analysis, the increased risk is 28% or so for ulcerative colitis. So that's another problem that should be acknowledged. Now, again, I'm a rheumatologist. I saw a lot of patients with a disease called systemic lupus erythematosus. And this is a very severe inflammatory disease. It affects multiple parts of the body, and hormonal contraceptives can increase the risk of developing lupus from 20% to 130%, depending on the study you look at. So clearly a really remarkably and serious increase in this risk. Now, there's less data on some other studies, such as multiple sclerosis, which is inflammation of the brain, and interstitial cystitis, which is inflammation of the bladder, autoimmune inflammation of the bladder. But these also appear to have increased risks if a woman uses a hormonally active contraceptive. Now, to be fair, I should note that thyroid disease, hypothyroidism, is decreased in women who use these agents. But overall, the risk for autoimmune disease appears to be increased in women who use hormonally active contraceptives. So that's something that I think should be known, that women should be cognizant of, and should seek other methods of controlling their fertility that don't use drugs like natural family planning and fertility awareness-based methods. This is Dr. Bill Williams. Thank you very much for listening.